Hi, everyone. Thank you for joining us for another episode of Root Cause Solutions for You. My name is Fabiola, and I am your host. Today, I'm super happy to have Dr. Lisa Palmer, who is the founder of Quantum Nutrition Testing Academy, and she's also the owner at Palmer Natural Health in Orlando. Thank you so much, Dr. Lisa, for being here with us today.
Thank you for having me, Fabiola. It's an honor to be on your show.
Tell us a little bit about yourself and what got you into natural health.
Oh, yeah. I'll try to make it a short story because there's many pieces to the story, but I became a doctor of chiropractic after many things that happened in my life. And the short answer is that I was an emergency C-section birth. They gave me 5% chance of surviving it. My mom woke up at 3 a.m. with my umbilical cord out of her, and she woke up my father and said, "This isn't good." And he sped to the hospital. The surgeon said, "We're not quite sure she's going to make it." And so they called me Miracle Baby for a long time because obviously I'm here. But the reason why my umbilical cord was no longer in my mother's body was because her uterus is a very unique shape. It's heart shaped. And because of the shape of her uterus, there was not enough room for me in the umbilical cord. But also, my legs were not formed properly. So they were internally rotated. My feet were like kissing each other. The surgeon thought, okay, well, your baby survived birth, but she may not be able to walk. And so they had me in those leg braces. I had to wear my shoes on my opposite feet. And then they thought perhaps she'll need leg surgery. A friend of the family said, "Why don't you try chiropractic?" I was born in the 70s, and people were like, "What?" My parents were like, "I don't even know what chiropractic is." And honestly, I didn't really understand what chiropractic was. All I knew is I had my chiropractor, who was this nice lady named Dr. Vicky, who would put these triangular wedges underneath my hips and do chiropractic. I didn't even know it was chiropractic because I didn't really understand because I was an infant on. And then I had this other doctor that had this nurse that had this tray that I wanted to kick out of her hands because it usually meant she was going to jab me with something because I was vaccinated as a kid. And I just went through life having two different doctors. And because of chiropractic, was able to walk, play high school, college, and professional sports, and thought, this is really cool stuff. I should do this. And that's how I got into chiropractic.
And one of the things I've always admired, it's you've been always determined, even from a baby.
Yeah, I was coming, definitely fighting the odds. So thank you for that acknowledgement. I don't really think of it like that. I just think of what's the next thing that needs to be done, whether it is being born or being able to walk, run, do all those things that I did. It's interesting because as a kid, I didn't even think of it as a challenge or a deficit or disability or anything like that. I just thought of it as I want to play soccer, so I'm going to play. And I remember I actually made in middle school, we didn't have a girls' team. We only had a boys' team. And so I tried out for the boys' team and I made the boys' team. And my father was like, "Absolutely not. You're not playing soccer with boys." I'm like, "Why not? I'm good enough to make the team." And he was afraid I was going to get injured because guys are faster. I'll admit they're faster. They have better muscle structure than women typically. And so he was afraid that I was going to get hurt. So I started playing soccer in high school. But yeah, it wasn't even a consideration that it wasn't going to happen. It was just it's the next thing.
I love it. And I think that's so important, right? As a practitioner, intention. And that's one of the things I love about your technique, quantum nutrition testing, because it's about the intention. When we are in class, one of the things you mentioned is what's your intention when you're working on this person? So that leads me into asking you, so what is the quantum nutrition testing and how did you found the need to develop this technique?
I really wasn't looking to develop a academy or online training or in-person training. Our practice, Palmer Natural Health, is a very busy practice. We see about 400 patient visits a week. We have 5 associate practitioners, and really wasn't looking to do outside training, although I love teaching. So I taught muscle testing for a really long time. I taught in the sports chiropractic world for a long time. I taught in the sports medicine world for a long time. So I enjoyed the teaching aspect, but really wasn't looking to start an academy. And how it happened was my father one night woke up, he slipped on the tile and he hit his head on a wooden nightstand. And my mom called me. She knows that I'm very versed in concussions, working with college athletes, working with professional athletes, mainly a lot of soccer players, but I also worked American football and rugby and crazy ice hockey. So after almost 30 years on sidelines, very good in the concussion space. So I evaluated my dad for concussion and didn't see any signs. And this is during the pandemic when the hospitals were basically closed. You remember that nightmare. And the word on the street was don't go to the hospital unless you're pretty much dying. And that was that during that time period. And so we did not want to take my father to the hospital. He didn't have any signs of concussion or anything else. So I felt very comfortable just keeping an eye on him. But 2 days later, we noticed the left side of his face started to sag. His left arm started to lose function, and he wasn't able to stand on his left leg. And I said, Mom, I said, look, I don't want to take him to the hospital because there was no visitation, but I also don't want to be negligent and not have him checked out because now his body's changing in a way that's detrimental. And so we sent him to the hospital. There was no visitation, but we were allowed to be in the emergency room. And it was interesting because they ran a CT scan, they did an MRI, they did blood work, they started IV, and the neurologist came down. The neurosurgeon actually came down to the ER to go over his films, and he didn't know that I was a doctor of chiropractic or I'm a doctor of chiropractic. He just thought I was the daughter of the patient. My sister's a naturopath. She was there. He didn't know she was a naturopath. My mom's an RN and worked at a huge public hospital in Miami, and he didn't know any of our training levels. And he's just talking out loud. Oh yeah, I see where there was some inflammation. He goes, but if you had brought your father in when this happened, most likely I would have drilled a hole into his skull to drain the blood out. But it's weird. It's like a miracle. 48 hours and his brain is already healing. And so for me, being in natural healthcare, just like you, Fabiola, we believe that the body heals itself. And so to me, I was like, yeah, of course the body heals itself. And it made me wonder how many people got a hole drilled in their skull that really he could have just gave them a little bit more time to see what would happen. Can this person heal? Or do they need some kind of surgical intervention? Some people think as a holistic doctor, I don't like the medical profession, and that's absolutely not true. A medical surgeon saved my life when I was an infant. And then I do appreciate the orthopedist that worked on me and so on. But I do think that the holistic component of letting the body heal itself or giving the body the nutrients or the vitamins or the minerals, what you do all day long, Fabiola, and finding the cause is often neglected just because of their training. I think if they knew that they could, then it was accepted that they would do so as well. They would be part of the holistic healthcare team. So then long story short, my father, they ended up keeping him for a month in mid-hospital stay. He was transferred to another room. The nurse had forgot to plug in the call button and actually his vitals as well. They were understaffed. It was a horrible time. We couldn't visit him because there was no visitation. Our governor in basically everywhere nationwide shut hospitals down for visitation. And I'm sure that you would agree that it's very important to advocate for your family members, to be able to speak on their behalf if they can't speak, to be able to help with challenging decisions or challenging things that come up in care, and then definitely advocate for what you want to have done and what you don't want to have done and so on. And mid-stay, he was having some issues, and because they forgot when they transferred his bed, they pushed him from one room to another in his bed. They forgot to plug everything in. He was in extreme pain and he couldn't get a hold of anyone. It was around the same time that I figured that I had always muscle tested pushing on someone's arm, and I tried to test from a distance, which was a newer concept. Some people had talked about, like they had played around with things like that, but I never really did that because all my patients would come to my office and see me. And so I put my thumb and my index finger together and I started testing, and I tested my father and I found that he had a kidney stone because knowing his paperwork and working on him for 20 years, he made kidney stones. So he was testing. I tested from a distance and I found out he was producing a kidney stone. And I found out I asked what type of supplementation would handle that. And there's a product from Systemic Formulas called KDAR, which breaks up kidney stones. And then I determined what the dose would be. And I thought that was really interesting. And I went back to sleep. My mother called me the next morning and she's, Lisa, you'll never believe what happened last night. Is your dad was in extreme pain and his call button wasn't working because for whatever reason, they didn't plug in any of his vitals or his call button. And he ended up calling 911, and the dispatcher got a hold of the hospital, which got a hold of the nurses on his floor, which found out that he was in pain and none of his stuff was plugged in. And that's why he couldn't communicate with them. And they analyzed his system because he was in extreme abdominal pain, and they found out his bladder was retaining fluid, but they don't know why. And I was like, Mom, I tested dad. And she's like, you went there? And I'm like, no, I tested him from my house and this is what I found. And so that was really the creation of quantum nutrition testing, which was so cool. And then from that point, we decided to start putting supplementation into his breakfast. Because at the hospital, they don't feed you real food, they feed you pudding, McDonald's, pancakes, whatever. And so my mother was awesome. She would bring him food every day, and we put his supplements in his food, and he got better. Then finally, a month after he got admitted, he was released in outpatient rehab. And I was able to see him. Our governor opened up visitation. I was able to see him in the hospital. I quantum tested him from my house that morning. And then when I arrived at the hospital, I old school tested him by pushing on his arm. And what I found from my house and what I found seeing him live was the same. Dad, we didn't tell him. We're like, Dad, we've been putting vitamins and minerals in your food, and we want to get you out of here. And he's like, yeah, thank you. Get me out of here. The food's horrible and you can't rest because nurses are always checking on you. And that's how quantum came to be. My husband has a show called Brave TV, and people were looking for answers during the pandemic on how they could boost their immune system. And one day he said, hey, if you need help, call the office. 350 people called in from all over the world. And I thought, okay, we can do this quantum testing with them and figure out what can we do naturally to boost the immune system. And so quantum nutrition testing wasn't just a thing that I did to help my father. It became something that we did internationally to help people boost their immune system and not have to live in fear over a virus.
Yeah, that's true. And how many practitioners have you trained since?
I was thinking about that the other day. So we launched the Quantum Academy in 2022. So it's online, qntacademy.com. And then when part of the country was still locked down, Florida was very open. And so we were one of the only in-person seminars that were existing. And so since 2022, March 2022 is when the Academy was birthed, if you will. I've trained every single month since then. So I have to go and look at our actual numbers, but hundreds of practitioners, from chiropractors to health coaches, training a lot of nurses lately, naturopaths, and so on. So really, I'll train anyone who has a passion for wanting to help and wanting to help people naturally.
That's awesome. And that's where the intention, you speak a lot of when you're doing training, your intention behind helping this person. Like you get out of your head and then you trust that answer. Just like when you're first learning to muscle test by in person. Because for some people, sometimes muscle testing, it's a little out there already. And then when you introduce something as unique as quantum testing, and then getting into the realm of quantum physics, then people really you need to get out of your head as a client as well as a practitioner. And I was talking to a client the other day, and I said, we're resorting to different methods now. We are having to think outside the box because we're just a very ill society. We're not very healthy. We spend billions of dollars on healthcare, and there's more diabetes than any other time. There's more cardiovascular disease. How many people passed during the pandemic because their immune systems were not strong enough? How many people still suffering from the effects of that and the medications and pills? And we get beat up so much. And having to think outside the box, I think, is so important. So we think, how are chemicals impacting you? How are parasites and mold toxicity, right? And I love how QNT fits right into that philosophy in regards to helping people. So I love it. Can you share some case studies?
Yeah, absolutely. Yeah, and thank you for that. So I agree. I'm a little biased. The quantum nutrition testing it's efficient, it's effective. I thought training the docs would be easier, but actually it's the holistic practitioners, the coaches that are easier to train. I think doctors overcomplicate things. And so they're actually more difficult to train than the holistic coaches. And the nurses can be a little bit difficult just because they sometimes think in a nurse, what I call it, their nurse brain. And they're like, okay, what's the label? And then what's the supplement? They think of supplements like medications. I'm like, no, it's not like that. The supplementation balances out the body
Yeah.
and improves the immune system naturally and fixes the nutritional deficiencies. One of my cases during the pandemic, who we still work with, was a listener of Brave TV. She called in and she had gone to Mexico on vacation, and she went to an all-inclusive resort, all you can eat food, all you can drink, and that kind of stuff. And a lot of people say, oh, well, you pick up a parasite, you must have went to Mexico, or you must have went to India, or you must have went to somewhere else. We as have parasites in the United States as well. After her trip to Mexico, she got really sick. She got extremely fatigued. She said she could barely walk in the airport. She ended up getting hospitalized, and they ran blood work and they found her blood sugar levels were off the charts. Now, before her trip to Mexico, she was not diagnosed with diabetes of any kind. After her trip to Mexico, she was diagnosed with diabetes and given insulin, units of insulin, and told that she was diabetic. And she was shocked. She's, what do you mean? I've never been diagnosed diabetic. And she's in her late 40s. And so I was like, wow, that's really interesting. So she called to see if there's anything that could be done naturally to help her with her diabetes. And in applying quantum nutrition testing, we gather all the patient's data and we ask deep questions. As you do quantum, we ask questions on their family history. We ask questions on what they eat. We ask questions on if they're female, what are their female cycles like? Have they had kids? Have they had mold exposure and so on? And then we take that data and we actually quantum test the data to see what is their personalized program. And so with looking and analyzing her information, I found that she had an immune challenge in her system. And the immune challenge looked a lot like a parasite, acted a lot like a parasite, and put together different herbs. I love the Cellcore product line in handling parasites. It's the most efficient, effective product line for that. And not only does that supplementation handle immune challenges like parasites and viruses and bacteria and mold, but it also helps to strengthen the organs and the glands. So I think a lot of people look at those herbs and they think these are killers for parasites. And absolutely that is true. But it also helps to strengthen the immune system, the cardiovascular system, and the endocrine system, and so on. And so I got on the phone with her and I said, hey, there's a cause to why your body can't handle blood sugar issues. Your pancreas is compromised, and there's some buggies in there that seem to be throwing a party and affecting your ability to regulate your blood sugar. We mailed her supplementation. We worked with her food. We helped her with lifestyle. She had a bit of stress in her life, helped her with all those things. And still, as of this day, I talked to her last week. She is no longer diabetic. She is no longer on insulin. She is not on any kind of medication because they put her on a whole bunch of stuff. She came out of the hospital with 7 prescriptions. She went from 0 prescriptions to 7 prescriptions and insulin. And so now I'm super happy to say she's no longer diabetic. She's no longer on insulin. She no longer needs any medications. I didn't take her off the insulin. I didn't take her off the medications. I'm not licensed to do, but with the quantum nutrition testing properly applied, her body has rebalanced itself. I taught her how to eat healthy foods, what her system does well with. And it doesn't mean you have to eat salads and berries all day, right? That's no fun. And she's doing awesome. And in fact, she's so passionate about it that wants to help her friends and her family and her community as well. That June 7th, 8th is another quantum nutrition testing level 1. And so she's going to fly from Iowa to attend level 1 so she can help others like I helped her.
Wow, that's awesome. That's
Thank
huge.
you.
Yeah, to not be diabetic and then after a vacation and then you come back diabetic. That's maybe not the vacation she was looking for.
Not the vacation she was looking for. Yeah, a rough time. And then the cool thing is that she started getting her husband on a program, and then some of her other family members, and then her daughter-in-law, I think her daughter-in-law had a baby. And because of what I taught her as a patient, and she understood the negative effects of vaccines, that she educated her daughter, and her daughter did not vaccinate the child. And she has one child that is vaccinated, appears to be on the spectrum, and one that's not vaccinated. And the mother can see the difference in the 2 kids. And so it's really cool to see the positive effect of for what we do, Fabiola, we're not just saying, here, take these supplements and see you later. We empower them by giving them the knowledge by giving them the data that they need to, they can apply not only to their own lives, but then they start applying it to their spouse and applying it to their grandkids and their daughter-in-law and so on. And it's so cool to see the positive effect when someone decides to do quantum nutrition with testing. It really changes generational health.
That's true, because it's about education and, like you said, empowering other people. And we were just at a conference where one of the speakers talked about, and within her program, teaching her clients not be codependent of you as a practitioner. It doesn't mean that we don't have a role as a practitioner, but our job is to make sure that people are healthier. And I think being healthier is just part of the equation. It's a stepping stone to actually achieving. Why do people want to be healthier? What are they missing out in life? What is the health holding them back from travel? Or I want to not break in hives when I get nervous, or gosh, you name it. So many different things that will experience.
And anything really that's a symptom, right? And so I think in our society, and you see this too with your patients, is patients get used to, they're like, that's my normal migraine. I'm like, normal doesn't go with migraine, or that's my normal PMS, or that's my normal bloating. I'm like, no, that is not healthy function. Anything that's a symptom is a sign of imbalance, a sign of dis-ease, a sign of the body's not working properly. And then we don't try to suppress the symptom. We don't say, oh, you're in pain, here, take this pain pill. Let's manage your pain. I hate that term. We look for what is the cause, and you were saying earlier, is it a chemical toxicity? Is it a metal toxicity? Do they have a moldy basement? Are they in a moldy environment? Were they exposed to something earlier in their life that's still negatively affecting them? We look for the cause, and why we get great results, and you get great results in your practices, we're identifying the cause. Then we're not just saying, hey, this is my favorite supplement, so go ahead and take it, or here's the supplement I have on stock. We look for the exact right one for that patient or client. And then we don't just say, here, go take this stuff. We hold their hand and we help them with whatever lifestyle changes. Like maybe they don't know what to eat for breakfast. Maybe they're in a high stress job. Maybe they're so sick that they're not really sure how to interact with their kids. So they turn into a mean mom. Like they yell all the time. I've had patients tell me, thank you for helping my mom, because now she's not a mean mom anymore. And I'm like, oh my goodness. But I can understand someone who's not feeling well never comes in the office and says, yay, I feel horrible. They're a little irritable, they're a little cranky, they're a little hangry. They're just not optimal. No one wants to be like that. It's just their system is imbalanced, that their mood gets negatively affected as well.
Yeah, no, I agree. And one of the things I love about holistic health and muscle testing and quantum nutrition testing is that it's a non-diagnostic, safe way of helping others. And I think we're at a point in our society, I think is even more evident for me now, where we're desperate to get better, right? We're desperate for solutions. I think if people are willing to take whatever medications have been prescribed by the doctor, and if the number keeps increasing every time they go and see their doctor, and they're willing to do that, it's because they want to get better. I think there's just such a need for people, such a want for people to really want to be healthier. And how many people I've seen that come to us and be like, I've seen so many other people or so many other doctors, and no one can help me, and they think I'm crazy. And I'm like, let's let's put that aside for a second, and let's really dive into as to what's behind all of this. And that's one of the things I love about what we do, because it really allows us to be able to do that. And obviously, yes, as we're healing the body, there's going to be reactions, right? And the supplements are not medication, so there's no side effects, but that doesn't mean the body's not responding to what we're doing. And sometimes it takes tweaking, and it takes commitment and patience, because healing takes time. And one thing I tell people is, like, we live in a very fast society right now. You don't get your Amazon Prime order in 2 days and you're immediately like in support and demanding free shipping or refund. Drive-throughs, right? If you're going through a drive-through and it's more than 5 minutes, you're like, what's going on? Who ordered what?
Right.
Where my
Yeah.
order? Why is this not moving? And
On demand. Yeah.
yeah, and healing is not linear. We think we're gonna go from point A to point B and then C, and then I'm like, no, we're gonna go probably from point A to point Y, and then we're gonna go back to A and then C. So I just
You're absolutely right. Yeah.
Yeah. And what we do is so important. So I really appreciate your commitment and training others, and no matter their background, because just like your client, to then be able to practice quantum nutrition testing to really be able to help others.
Yeah, to me, my viewpoint is if they want to learn and they want to help, then definitely I'll train them. And then some of these guys would be awesome practitioners for someone like you with an established practice. Some of these guys would want to start on their own. And then a project that's been on the burner, because it is a bit of a project, is putting together a practitioner network where my company would do the marketing and the shipping and the scheduling and kind of run all the pieces, and the practitioners would have the ability to show up and help people. So that is one of the plans. It's a bit of a big goal that I've been looking at shipping out pieces of to
Yeah.
help. But how do we, I think one of the biggest obstacles is when you're looking at holistic healthcare, it's not like you go to the hospital and they employ you. You don't get into that system, and you have to be a holistic practitioner and you have to be an entrepreneur. And not everybody wants to do that, or not everybody has that in their wheelhouse. And so to be able to create a network where the marketing is done for them, the business side is done for them, and really the practitioner just has to be a very good practitioner and apply quantum nutrition testing to their patients, to their clients, to help find the cause, rebalance the body, and then health happens after that.
Yeah, that's awesome, because we need to be more, there needs to be more of us, that's for sure. So obviously, if a client listening to this, practices are always looking for practitioners to join the ranks. And there's definitely no limit, right? Because we're in desperate need of help and stuff like that. And I don't think of it as alternative health. Like back in the 1800s, if you wanted to be a doctor, you had to know homeopathy. You had to go through certain curriculum to of natural health. But we've, because of different how society's been shaped and agendas and whatnot, we've become like the alternative, like the other thing you do on the side. But we create so many positive things with our clients every day by doing what we do.
One of my staff was calling me today, and they're like, I did so we do just like you do, we do the consultation and we speak with patients for a good chunk of time and get all their information. And a lot of times it's the first time that's ever happened for them. And
Yeah.
then we do the quantum nutrition testing and then we present a report. And so one of my associate practitioners presented this gentleman the report. And he goes, I don't know, like you said, it's alternative and I don't quite understand. And I'm like, you know what? At the end of the day, if they go to their medical doctor and the medical doctor says, Mr. Jones, you're getting older. So what we're going to do is we're going to make you drink this horrible stuff for a whole day. And you're going to have to stay in the bathroom the whole day because you're going to have diarrhea the whole day. We're going to clean out your colon. And then we're going to give you anesthesia. We're going to knock you out with your butt in the air and take some clamps and open up your butt cheeks. And we're going to take a big tube and stick a camera in your butt and take pictures of your colon. And sometimes we scrape the colon, sometimes we perforate or puncture the colon. And we'll take some pictures. We might take some samples and cut some stuff in your intestines while we're there. And we'll take that out. And then eventually you'll wake up and we'll tell you if you're going to have colon cancer or not. If you think about some of the medical procedures or exploratory surgery, every moment in this society is geared towards medicine. You look at the pharma ads, you look at what they teach at Sesame Street, you look at, oh, you have to go see the doctor, and the doctor has a stethoscope and all these things. Everything is geared in our society towards that medical model. And so anything that is not that medical model gets labeled alternative. But when you start to think of some of the crazy stuff with what the medical model does, you're going to basically make someone poop all day, knock them out, take pictures of their colon, shove a tube. And it's not a gentle thing. One of my patients does that procedure. They have the tubing and they're like jamming this thing because the colon isn't this straight line, it has curves. And sometimes they really have to jam that tubing in to get around the corners of the colon. And so sometimes when patients say what you do is different, I'm like, yeah, it is absolutely different because I don't want to be part of that model. That model has always been broken and it will always result in either you take a medication that always has side effects or we cut something out of you that belongs in the body. You're supposed to have a gallbladder. You're supposed to have an appendix. You're supposed to have tonsils. You're supposed to have all of your intestines. You're supposed to have both kidneys and so on. And to me, no other profession, if you remove something, doesn't make it better. If you go to your mechanic and they say, yeah, you know what, that right brake, it's just not really good. So we're just going to take it out and we're not going to replace it. You would think it's the worst mechanic in the world, but that's what surgeons tend to do is they're like, okay, let's just cut that gallbladder out. You don't need it or that appendix or that whatever. It's pretty insane when you give people those kinds of examples.
Yeah, and you don't give it a second thought, right? Sometimes people are like, "Oh yeah, I had my gallbladder removed," and I'm like, "Okay, understood. Plan B now, right?" Because
Yeah.
we're working on plan A, now we're jumping to plan B. But yeah, we don't give a second thought, and sometimes I think just because we don't understand something, it doesn't mean it's not good, right? Obviously, understanding it's important what you are getting involved into, your commitment financially, time, and everything. Innovation. We know throughout history, we've come up with techniques and different things and discoveries, and all begun from something that people didn't truly understand and it developed. And now, how many years, decades, or hundreds of years later, we don't even think of it. It's just part of who we are. Like back in the 50s, I think T3 and T4, the thyroid hormones, were not even acknowledged of their existence. And it wasn't until the 70s, oh yeah, these hormones do exist. And I was like, what? That's no long ago. And now we know we don't refute the existence of these hormones because now someone dared to think outside the box, discover more of the human body. So I think the same with holistic care, alternative care, muscle testing, quantum nutrition testing. If you're not feeling well, you have nothing to lose, but so much to gain from trying something different because doing the same thing over and over, the same thing may not give you the same result. And yeah, people want to get healthier. I think I see a lot of people who come to the practice now, they're like, I just want to feel better. And sometimes people are in tears because no one is listening to them. And I feel like our group does that, the holistic care practitioner. So that's why I love it. And I've seen more doctors actually, more like on social media and training and conferences, who are going back to that oath that why do they want to become doctors to begin with? And it's so refreshing as a holistic practitioners to have those people in our corner because they're speaking our language too. So I think you're training, like you said, you're training so many people from so many different professions. Yeah.
Absolutely. Yeah. People are looking for answers. They're looking for the cause of their problem. And then you had mentioned about T3 and T4, the thyroid hormones, and how that was missed in the 50s. When you look at the human body, the physiology, it's theories. It's a theory on muscle contraction. It's a theory on how the heart beats. It's a theory on how respiration occurs. It's a theory on a lot of these physiological processes to the point where there's only a couple laws. So laws are absolute. Theories are, we think it's like this. And so people are like, how does that work? And what does that work? And I'm like, okay, one of the speakers we had at ECO last year on the heart, people think that the heart is a pump, but it's not really a pump. Because if you were to look at this from an engineering standpoint, there's no way that pump would pump through all the different vasculature, all the blood vessels, all the arteries, all the circulatory processes in the body. There's no way it could do that. And so he's even questioning. So here's a very famous cardiologist that's questioning how the heart pumps itself, how the circulatory system functions itself. And to me, that's like a very basic thing that we learned in elementary school. And yet they're questioning it. They're questioning brain function. When I was at the University of Florida, we had just got in the late 90s, we got a brain institute. And they were very proud of this brain research center. And they're like, we know with the Brain Research Institute that we know 10% of its function. I'm like, you guys are bragging about 10%. What about the other 90%? So you're saying we don't know what 90% of the brain is doing? And that's what I took from that is, yeah, they don't know. And so in the line of work that we do in holistic healthcare with quantum nutrition testing as the technology, people will ask me, how do I know that it works? I'm like, because we get results. And the results are not tied to a medication with side effects. The results are not tied to cutting pieces of the body out. The results are not tied to future side effects or future potential class action lawsuits, which I think we're going to see with Ozempic and these type of semaglutide drugs. People are on the weight loss bandwagon, but they don't understand that chemical comes with a price. And unfortunately, that price is linked to thyroid cancer and it's linked to food rotting in the stomach and things shutting down. Whereas quantum nutrition testing, we're not doing anything to suppress the symptoms, but rather we're giving vitamins, we're giving minerals, we're giving electrolytes, we're giving specific herbs to rebalance the body so the body can autocorrect itself and then regain its health and improve health.
Yeah.
And to me, I'm very biased, but to me, that's the best way, is not to suppress things with chemicals that always have side effects, whether it's a Tylenol, ibuprofen, or something more intense like the Ozempic drug. I turn the radio on, all I hear is this Ozempic stuff being pushed, and it's not safe and it's not natural. And in my opinion, is not the way that you rebalance weight or anything. If someone has weight gain, we look for, in quantum nutrition testing, we look for the cause. Is it a thyroid that's underperforming? Is it high stress levels? Our society is so stressed out. Is
Yeah.
it someone living in mold? If you're living in mold, you could eat perfectly everything organic, but that mold's going to throw off female hormones and the person's going to be puffy and inflamed and gain weight.
Yeah.
And
Yeah.
so I totally agree with you. Quantum nutrition testing has an amazing place in natural health care.
Yeah, there's one more story I want to share with clients and with our audience. There was a client who was experiencing asthma and very sensitive to the environment, couldn't actually leave her house. And I had just freshly come from one of the trainings. We started doing Q&T. We would just like every week, just like on her program, and we will mail her supplements or her husband will come and pick them up. And little by little, she started getting better to the point where she could now come to the office to do her appointments in person
Wow.
because so much better. And I was like, "Oh my gosh, this is so great." And what a great tool. Could she been denied care before then, before Q&T, not really knowing how to apply this technique because of her specific situation? Let's wait until you get better, until you can get out of the house or whatever. How much other conventional treatment after, how much more cleanup we would have to do after conventional treatment. And now she comes to her appointments in person because she can leave her house because her asthma is no longer an issue for her. So I just
Gosh,
wanted
I
to
love
share.
that.
Yeah, I wanted to share that. I was like, "Oh, I gotta share that story because that is how you transform someone's health." So, no, that's awesome.
Yes.
So, we're gonna put in the show notes the links on how to reach the Q&T website, and then I think you all the information it's in there. We'll put all the necessary information so that if anyone of any background, whether client or practitioner, retired or who's looking for a new game, or someone who's still in practice wants to become a practitioner, how to become a Q&T practitioner. And was there anything else you wanted to go over before we end off?
Yeah. So if you have on your heart, if you have a mission, a purpose to serve, and you want to help people naturally, you know that holistic healthcare is the way to go, and you're looking for a system that's efficient, effective. Quantum nutrition testing, I would love to train you. I recommend, Fabiola put the link in the show notes. I recommend to start in the online academy. It's a monthly membership, and it has data on how to handle mold, how to handle chemicals, metals, parasites, and so on, but also how to do the quantum nutrition testing. And so my most successful students will start online in the academy. They start learning. It includes Tuesday night clinical coaching where we go over various different patient cases and I teach on the subject. We share clinical wins. A lot of times practitioners feel like they're stuck on an island. Their cup gets very empty. They get burnt out because it's rough working on people that don't feel good. Sometimes they're a little cranky. Sometimes you take a loss on somebody you really want to help and then they won't let you help them. So that could be frustrating. And so the clinical coaching on Tuesday nights is very positive. It's awesome. The quantum healer community is an awesome community. And I would love to help you. So you can start in the academy and do some online training. Show up in Florida for level 1. The next step after that would be level 2 and 3 and so on. And then, of course, I'd love to invite everybody to our end of the year event, which is in Orlando, Florida, December 13th through 15th. And we have amazing speakers like Dr. Sherry Tenpenny on vaccines and what's happening with that. We have Dr. Jason Dean speaking on your health freedoms. We have Dr. Darren Schmidt speaking on quantum physics and some awesome things in business expansion and marketing. And so we have a great speaker lineup. And the purpose of the conference is to get everybody together and share successful clinical outcomes, marketing, business, and it is meant for the mom that wants to get into natural health care all the way to the successful business owner with multiple associate practitioners. Would love to have you guys in December.
That's awesome. Thank you so much, Dr. Lisa, for being here with us today. Your knowledge and expertise is very appreciated. Thank you so much for sharing everything that you've shared so far. And we cannot wait until see what's next because we're always looking for more.
Awesome. Thanks, Fabiola. It's been a pleasure being on your show.
Awesome. All right. Until next time. Thank you, guys.